Hi, I'm Dr. J. Varma, and welcome to Thermometer. On this channel, I check the temperature of health in the United States and around the world and give you expert insights on public health and infectious disease. This is our weekly episode of Inside Outbreaks. And on these episodes, I review the latest outbreaks of infectious diseases, outbreaks that you need to know about. And I do this with my friend and colleague, Jon Epstein, veterinarian, virologist, and disease ecologist, who, like me, has spent his career tracking infectious diseases across all corners of the world. Thanks, Jon, for joining me today.
Thanks, Jay. It's good to be here. How are you doing today?
Good. Just and recovering in a good way from a nice Memorial Day weekend and ready to, unfortunately, talk about a huge number of events that have happened that are not necessarily outbreaks, but they relate to the possibility of how we control future outbreaks. And so I wanted to start today with one of the many announcements that came from HHS that the federal government will no longer be recommending COVID-19 vaccines for healthy children and pregnant women. Mm-hmm. That announcement, unfortunately, was made by RFK Jr., the HHS secretary, flanked on either side by the new FDA director and the new NIH director. Notably, that decision was not made with anybody from CDC or CDC's Advisory Committee on Immunization Practices. And really the other thing that's unusual and bizarre about this announcement is that it was made on Twitter or X with a video. And there was no documentation of the scientific rationale for this. And I wanted to start with this decision because, one of the purposes of this show that we have here is to keep people aware and to help you manage your risk in a world and live healthy and productive lives. And it would seem to me that a decision as important as this, basically saying that the vast majority of Americans do not need COVID vaccines, is going to be problematic. So, Jon, I'm curious what your thoughts are.
Yeah, I can't help but see the irony in this that, RFK Jr.'s whole platform was about more transparency and rigor in discussing, especially vaccine safety and recommendations and giving people a lot of individual choice around whether or not to use vaccines. But to come out with decisions that are blatantly opaque, where there's no real reasoning given, there's no evidence presented as to why they're making this decision, and to exclude a committee of experts, a panel of experts at CDC who, historically deliberate on the data and evidence and make evidence-based decisions, seems strange to me. So right away, the decision, I'm uncomfortable with it.
Yeah, so I want to talk about a couple of things. So you highlight one of the most important aspects of hypocrisy here, and this is unfortunately a common theme among extreme COVID contrarians, RFK Jr., this Make America Healthy Again movement. First, they always talk about transparency, and they claim the federal government before they arrived was non-transparent. And yet, as you point out, these decisions were made without any clarity or discussion about why they were being reconsidered and why they were being made. And that's number one. And number two is they talk all the time about chronic illness and how we have an epidemic of chronic illness. And we know very well, as we'll talk about very clearly in our next segment, that COVID is not just an acute respiratory illness. It causes a wide range of complications beyond that, which relate to chronic disease. And I particularly want to highlight the third hypocrisy, was that so much of the discussion that you hear out of this administration is how they want to protect women. In fact, we know that pulling COVID vaccines away from pregnant women is going to do anything but protect women. They also say that they want to protect children. We also know that pulling COVID vaccines away is going to endanger the lives and the health specifically of the babies that are born to those women and potentially the lives of other children. And so, Jon, I know you've been looking at some of this data as well. And why don't you highlight for us a little bit specifically about this issue related to COVID vaccines and pregnancy?
Yeah, and we should mention that there's always this real hesitancy among pregnant women, I think specifically when it comes to vaccines. And, I understand that people are really concerned about, potential impact on the developing fetus and what the effects could be. But when there's evidence, when there's data that suggests not only it's safe, but it's also protective of both the mother and the developing child, I think it's hard to ignore that evidence. So I wanted to see, where the evidence was when it comes to COVID-19 vaccines and pregnant women, and whether this decision really was going to negatively impact that whole group of society. So I found this meta review, that's a large literature review of all studies that involve pregnant women and COVID-19 vaccines, all the different configurations of vaccines, though predominantly it was mRNA vaccines. And this was a study that was published just last year in July 2024. It was in the Journal of Drug Safety by Augustin Chaponi and company. And what they found, looking at over 170 studies, about 640,000 participants from 40 countries, looking at all the impacts on pregnant women from getting a COVID vaccine. And what they found was a statistical association with a reduction in the need for C-section, a reduction in stillbirth frequency, and protection against severe disease, both for the mother, and later a reduction in showing up at the emergency room for children born to mothers who were vaccinated during pregnancy. So the conclusion from this meta-analysis of all different studies was that not only was the vaccine safe in pregnant women, but it was protective and effective as well.
Absolutely, Jon. And I think, I want to get a message out there for anybody who is pregnant or considering getting pregnant. Do not run away from vaccines during your pregnancy. Run toward them. We know from a large body of studies that have been done that pregnancy does alter the immune system, and it puts the individual woman at risk, as well as the developing fetus as well. We know about the extreme benefit and safety of the pertussis vaccine, of the flu vaccine, of the COVID vaccine in protecting you during your pregnancy and protecting your baby from potential complications as well. And this is something that I know a lot of women, my wife and I have had 3 children. You have children yourself. We know about how much we love and want these children to be born healthy and safe. And we want our wives to go through this pregnancy without any complications. And I think it's really important for people to understand that pregnancy alters your immune system. And the single best way to boost your immune system is not by taking supplements, it's by getting vaccinated. Of course, there are some vaccines that we don't normally give in pregnancy. Your doctor will know about those, but there are some that are critically important. And I would again highlight the pertussis vaccine, the flu vaccine, and the COVID-19 vaccine.
Yeah, and I think the challenge here too is that, you're hearing a lot that the government wants individuals to be able to make decisions based on their own healthcare. And while it's all well and good, the truth is most people aren't going to pull up studies and look at data and really make the kind of informed decisions that their doctors would be able to make. And even more importantly, experts at the level of government institutions like CDC and FDA would be able to make. And then that leads to recommendations. So there is a risk when you don't have, government level recommendations that are based on evidence, is that there's a risk of misinformation influencing people's decisions, or just, a lack of understanding as to, what the reality is in terms of safety. So we have to be careful here, and we have to say that, yes, being informed is important, but we should also trust experts who are looking at data and evidence and making recommendations based on that.
Yeah, and this is fundamentally because the group of people who's now come into power feels that they were somehow slighted in the policy recommendations they wanted related to COVID-19. And this is where I think it gets really tricky. You have to be able to, and this is a problem with this group, to separate out the evidence, the scientific evidence, from the policy outcome. Getting from evidence to policy requires thinking a lot about legality and ethics, affordability, acceptability, and your values. And it is perfectly appropriate for people with different political views to disagree in how they want to control an epidemic. And I fully accept people who say they want, say, a more libertarian approach to things. But what I can't stand by is when people look at this vast amount of data showing benefit and simply say, we're going to disregard it because we think COVID was either a hoax, that it was overblown, or that we just don't like vaccines in general.
Yeah, no, it's God, we're getting into, tricky territory in terms of understanding, what the data is, what the reality is in terms of your own health and healthcare. So I think that really comes back to why we're doing this, Jay, is that we're trying to be a voice of reason, a trusted voice that presents evidence and information so that it can help people make sound decisions about vaccination and other healthcare.
Yeah, and I think, let's segue into our next segment here, which is that, a lot of times when people talk about COVID and want to minimize its importance, I fully get why, for a vast majority of healthy people, a COVID infection does not feel substantially worse than a regular common cold, especially after you've been vaccinated or you've been infected several times and you've developed, a fair amount of immunity to it. That's normal and expected by your immune system. But there are some complications of COVID that are particularly troublesome and problematic. And I want to talk about post-viral illness. Now, you and I are big basketball fans, and our favorite basketball team, the Boston Celtics, was one of the teams that was favored to win the NBA championship this year, and they got knocked out in the second round. And one of the reasons, of the many, that they got knocked out is that one of their star players, Kristaps Porziņģis, was basically unable to play during the entire postseason and missed many games at the end of the regular season because of persistent fatigue and shortness of breath. When they interviewed him, he'd be like, I'm completely gassed and I can't do anything. Right. And it was described essentially as a viral illness. And now some news reports have come out to describe it as not a acute viral infection, but what, as you and I know, is an extremely common and unfortunate condition, which is a post-viral syndrome. One form of that is long COVID. The news reports note that Kristaps Porziņģis was tested for COVID and didn't have COVID originally. But we also know that there's a large number of viruses that can cause this. So, Jon, why don't you tell us a little bit about post-viral illness and kind of the range of viruses that are kind of implicated in this and what that means about our bodies and our immune system?
I think it's really interesting because, remember, historically, it was really uncommon to ever diagnose a viral illness. You would go to the doctor, say, I'm feeling crappy, and they'd say, well, it's not bacterial. We're not going to put you on antibiotics. Maybe they did a throat culture, which hopefully they did, and that was negative. So the answer was, it's probably something viral. You're just going to have to rest, stay hydrated, and let your body take care of it. And you almost never knew what virus it was. But now we're doing more to be able to test, thanks to advances in technology and accessibility. Tests are cheaper, they're more accessible. More doctors' offices can run things like PCR tests, which detect viral genetic material in your body and can help say, well, maybe this is influenza or respiratory syncytial virus or COVID. There's a whole panel they can run. And so we're better able to say that, yes, it's a virus and here's what virus it is. And as a result of that, we're learning more about the impacts of post-viral infection. And that is that knowing that you had a viral infection, which during its acute phase, that means when the virus is actively replicating in your body, making more virus, taking over cells in your body, it is causing your body to fight that off. And that means fever, that means achiness, malaise. Sometimes it's a cough and a headache and those other symptoms that are associated with the active defense that your body puts up against infection. Then at some point, your body clears the virus. You no longer have the virus, but you still have the effects of that battle. All the cellular damage, all the impact of different systems in your body take some time to repair, even after the viral illness is over. And that leads to this post-viral syndrome. And it can manifest as severe fatigue, achiness and muscle achiness that, maybe isn't associated with fever anymore, but still you're just not feeling right. You're just not feeling better. And that can last for weeks. And I think that's what Kristaps Porziņģis was experiencing during the playoffs.
Yeah. And this is really problematic because there is a lot that we don't know as medical doctors about how to, treat this condition once it happens. You can get it after COVID, after influenza, after common cold viruses, a whole range of things. And it was very well documented, even after the great influenza pandemic, 1917, 1918, there was documentation about people having these prolonged viral illnesses, these prolonged sort of feelings of having, still having a virus hanging around in you. And of course, they didn't have testing at that time, but it's very well documented. So this is not a new condition. Rather, it's, as you point out, our awareness of it, because we now understand and have the ability to diagnose viruses. And there's still a lot of debate. There may be certain conditions in which there is persistence of the actual virus. There may be other conditions in which it's simply your body's immune system has been revved up in a way that's damaging your body instead of benefiting it. And there may be situations in which a combination of all of those. And really, because we don't have any way to treat it effectively, there's lots of people out there who recommend all sorts of things. But as we saw with an athlete who gets paid, I think, $30 million plus a year and who has access to the single best medical resources in the world based in Boston. If he can't get treatment for this, please keep in mind that any supplement advertising you see online, if Kristaps Porziņģis can't get better from this, there's not a lot out there that is. But there is going to be a way to prevent it, right?
Right. That's right. Well, obviously, this comes back to what we've been talking about, which is vaccinations for the things we know about that can protect us against those viral infections will go a long way to staving off any kind of post-viral illness. Even if you do get infected for something you're vaccinated for, chances are it's going to be a milder infection and probably less likely to lead to lingering effects.
Absolutely. And just to emphasize, the Celtics are a $6 billion franchise. Kristaps Porziņģis makes over $30 million a year. And if he can't get treated for post-viral syndrome effectively to win a championship, what the Celtics desperately wanted to do, please be careful about things that you see online that people are trying to sell you a possible cure for this.
Jay, I see that you're upset about this, as I am.
It does.
With his medical team.
Exactly. But I don't think there's anything I could have done with him, no matter how much I care about this. But I do emphasize to people there are ways to prevent this. Not 100%. And that's through vaccination. And studies have been done. Influenza vaccination, COVID vaccine, these reduce your risks of infection. And even if you get infected, they reduce the risk that you will develop one of these prolonged conditions. And so, Jon, the last thing I wanted to end with today was a discussion about another virus that's emerging, but this time not in the United States. It's one that emerged in New York City over 20 years ago called West Nile virus. And there's fears in the UK that climate change may be bringing this virus to the UK, which is not something that they've worried about before. This week, some UK scientists confirmed something that was basically destined to happen, that they found fragments of the West Nile virus in mosquito samples. And so, Jon, I'm curious what your thoughts are on this.
Sure. So let's talk about what West Nile virus is. West Nile virus is a flavivirus. It's in the same family of viruses as yellow fever and St. Louis encephalitis. It's a virus that is carried by birds primarily and transmitted by mosquito, and it occasionally gets into people and sometimes other animals too. It's been known to infect horses. It's even been known to infect reptiles like alligators down in Florida. And as you mentioned, it was first introduced from it's called West Nile virus because it comes from Northern Africa, and it was introduced into New York in 1999, probably through the transportation of infected mosquitoes via airplane, because the first cases were around, I believe, JFK Airport, and then kind of radiated out into Queens and other parts of New York City, and then spread across the entire country. So now West Nile virus is endemic here in the United States. And when it gets into people, it can cause severe fever and then central nervous system disease that leads to swelling of the brain and spinal cord, and it can end up being fatal in many cases. It's not very common, but when it happens, it has the potential to be bad. And so it was just detected in mosquitoes in the UK, and we don't know how it got there or when it got there, but in some ways this report is very good, because what it means, Jay, is that their surveillance system is working. They are checking mosquitoes, they are checking for vector-borne diseases. And then we've talked about things like climate change expanding the range of certain mosquitoes. The first thing that's most important is just knowing what they're carrying and knowing that it's there. So step one, check. They found West Nile virus there. Now they have to start to understand, is this common? Is this rare? Are there birds in the UK that might be carrying it? Or was this an errant mosquito or a group of mosquitoes that might have been transported there also through air travel?
Yeah. And it's just yet another example for all of us to keep in mind that, new diseases are emerging because of travel, because of climate change. And it's important for us to continue to fund these surveillance systems. And as you point out very rightfully, it's good to see that the UK continues to fund this type of surveillance, that is sampling the environment, things in the environment like mosquitoes, to give us all the kind of information that we need to stay healthy. And we know that we're entering into the summer months, here in the United States. And mosquitoes they're not just a pest, they are a potential, way of people getting infected. So doing all the things that we know are necessary, wearing mosquito repellent, trying to wear light, long sleeve clothing, particularly at dawn and dusk is going to be an important thing to keep you healthy and to keep those itching pests away as well too.
Jay, do you know what the single most deadly animal on the planet is?
I'm going to guess it's a mosquito.
You're right. Mosquitoes are responsible for more human deaths than any other animal by far in the world. So it just goes to show that the best thing we can do is protect ourselves from mosquito bites, because the reason they're so deadly is because they tend to carry many different viruses and have the ability to transmit to people.
Okay. And on that note, if you enjoyed what you were watching this week, please hit the like button. Please hit subscribe. Please share this episode with anybody in your life who might benefit from it. And Jon and I look forward to seeing you next time on an episode of Thermometer.
Take care and be well.